For more than 20 years, CTV has captured the moments that matter in our community. From our studios in St. Clair, you're watching Focus with Paul Dingeman.
Well, welcome. And we've got a really special person here today, Miss Deb Johnson.
Hello.
Returns to the Focus set after many months of activity that never stops.
I know, it never stops, but I'm so glad to be here today.
Well, nice to see you.
Nice
always
to see
look
you.
good as always.
Thank you.
We've got a lot to talk about. We're going to take all the time we need.
All right.
Let's talk first about, I'm going to do the new number right off the top of the show.
That's good.
You've had a change, and it's a big change, to a new, wonderfully easy number to remember for what?
For access to our services, the new number is 810-488-8888.
Super.
And
they got it on the screen. 810-488-8888. That's just super.
I know. Just 4, and remember, keep going with the 8s until the phone rings. But the other thing is, if somebody accidentally calls our old number that's still out there, 888-225-4447, it will, they'll do a warm transfer to our number, because that number is still being utilized for certain things.
Yeah.
And people, they'll roll it over to us. So I want people to remember that number. But another really great thing we did to try to make access to services easier is we have established, it's called the Behavioral Health Urgent Care Center. It's within our main location at 3111 Electric Avenue. And so if somebody is in crisis anytime between like 8 in the morning and 3:30, 4 o'clock, they can walk right in and get an intake, and we can get started.
Oh, that is new. That is
yeah,
great.
that's new. Because before you had to go to that other number, which was held by a different entity, they would decide if the person was eligible and then send them over or schedule an intake. Sometimes it would be a week away. So if they're in crisis, it wouldn't be a week. But this way, if you're in crisis, you can just walk right in, and we can do that. You can also walk in for a regular intake, but a person in crisis would take priority over somebody not in crisis, of course. But that number can be called for access, and the other number was 24/7, and while you can call that number 24/7, if you are not in crisis, at 4:30, it's going to roll over to our crisis line.
Oh, automatically.
But there will be a little message, and it will say, if you're in crisis, hit 1, mobile crisis is going to pick up. If you're not, please call back tomorrow.
Okay.
Between the hours of,
such and such.
Yeah. So we hope it will make access easier and quicker for people.
How many people have you served, say, in the St. Clair County area for the last year or so?
In the last year, we served, in that last fiscal year where I have the exact numbers, that would have ended like September 30th, 2024.
2020.
This 20, but it ended September 30th. That year we served 7,082 people.
Wonderful.
This year, which will end, the date ended 9/30 of this year, because 10/1 starts our fiscal year. I don't have the exact numbers yet, but we were on track to serve over 7,500 individuals.
Wonderful, wonderful.
Yeah.
And that's for the whole breadth of the community, county, from Algonac to Yale, back in Port Huron and St. Clair.
All over, yep. And we've continued to increase the numbers, because that in Marine City we opened the second office. Time flies when you're having fun. I think it was a year ago.
Yeah.
But so we have the 2 offices down there. The Broadway office is for children's services in that area, and the King Road is adult services in the area.
I drove by there the other day. It looks like you're going to have a neighbor in Marine City along King Road.
Oh.
It looks like a dollar store or
maybe another DG Market.
A DG Market, right? One of those places.
I was kind of opposed.
Which will bring more traffic to your area there, so that's good.
I was opposed at first to the DG by us, but then it's super convenient. They've got fresh food. They even have avocados, and they're good. And bananas, and good stuff.
Yeah, that's right. Good
I like
stuff.
it.
All right, let's get into October.
Okay.
Numbers of things happening. The first one is Substance Abuse Prevention Month.
Right.
Good-looking slide there.
Yes.
Tell a prevention story.
Yes, so substance use, and actually, if you recall, in the month of September, it was Recovery Month.
Yes.
And we did a whole recovery summit. We had lots of trainings to focus on substance use, recovery, and things like that, treatment and recovery. This month, the focus is on prevention, and so there's a lot, and it's to continue to raise awareness, educate people. about substances, especially among young people. And then it's also an opportunity for us to talk about stigma, because we know that stigma is the number one reason people don't seek services, whether it's mental health, substance use. And one of the things, we started a youth advisory group. It's called a teen advisory group. It's the nickname TAG. We have kids represented from every high school in this county.
Wow.
And then we also offered, if somebody's homeschooled, they're interested, or private schools, charter schools, they're welcome to give us a call. But at any rate, one of the things that the kids said right off the bat is, it's fine, people keep telling us, don't vape, don't do this, don't do that. They don't really tell us why it's so bad.
Okay.
So they,
Yes.
and I'm not sure that that's always the case, but I think, so we need to make sure we're doing a better job of educating kids on the what's going to happen.
Adults need to do that.
Right, we need, adults, teachers, schools. I know the health department they do a ton of great things with educating about it, but maybe kids aren't listening. And so one of the reasons we started that group was so that the kids can tell us what's the most effective way to get you to listen to what we're saying. And so they've only met twice, so we're working on it. And I don't know if you heard any of our mental health minutes for the month of September, but 2 kids from that group recorded them. I did one on some stuff, but then they did it on bullying and stuff.
Wonderful.
And yeah,
Wonderful.
they did. One kid had a great voice.
How many total students involved?
It's like 15, 16,
Oh, really
17,
good.
something like that.
Good.
And then we have a clinical staff person that is in charge of that group. She's a clinician. And then we also have another staff support. I think you might have met her before, Aubrey Mayhew, who, and she does a lot of work for me. And so she's also like the big support. In fact, they're both in DC right now, learning more great things on how to work with kids and to do this group for us.
The next one is National Depression and Mental Health Screening Month.
So again, the importance of that is if you think you have, depression or anything, and you should, actually, there's even online things you can do, and I wish I could give you a direct reference for one to try, but I've seen them before, and you can take the test, and it says if you score whatever, you should call a mental health professional, talk to your doctor, whatever. But if people are not sure, if your sadness or your symptoms, you're overly tired, you lost your motivation, all those kinds of things, if that lasts more than a week or so, and it could be situational too. Like obviously, if you just lost a loved one, that might go on for a while. You just lost your job, you got divorced. Those are that's normal things. But if none of those things are happening, or if those happen and it just you cannot get out, you need to call for help. And so call our number.
And don't ever be embarrassed to call for help.
Right. Don't be embarrassed, because it's no different. People have chemical reactions in their brains, different responses.
You break an arm, you ask for help.
Right. So,
Same story.
100%.
National Disability Employment Awareness Month. That's one I've not heard of before.
Well, and this is great because we have a great program. It's called IPS, Individual Placement Support, Independent Placement Supports. Look at me, I can't remember the name. And I just had a meeting with MRS, and our supervisor's name's Erica Rice that runs that program. And we started it, it's an evidence-based practice to help find employment for people with mental illness, but we've also expanded it to help people with developmental disabilities to get jobs. And I wish I could remember the numbers. Oh, I think I almost do. I think they found job placements for 99 people in the last year.
Wonderful.
We have it's a partnership agreement with MRS, and then our team helps find the jobs. And then I can't remember, a certain number of those were successfully closed already within the year, like 18 of them or something like that, meaning they were employed for more than 90 days with no issues. So that program's been going really well. And so we're excited about that.
I had not heard of this program before. This is new to me.
Yeah, and so we, like I said, so we help people, and we try to find like natural fits for people. You don't want to push a round peg in a square hole, or with that saying. You try to find what people enjoy, what they're good at, and a lot of the folks that we serve who we've put in jobs, they're some of the best workers. They're dependable, reliable. They're going to work. And the other thing is, if they start to falter at all, maybe they got a new task, maybe something happened in their life, give us a call. The job coach goes out, works with the people, and it goes good. The other thing we do is we have a really nice partnership with our clubhouse in town, and they do transitional employment, and that's where they place somebody, and different employers throughout the county, but they place one with us always in the facilities department, and then a staff comes with them to help teach them the job, watch them, then they work for us for a while, and then we give evaluation, and then they have a reference too to go on to get a job.
It's called Clubhouse?
Well, the Clubhouse is the program. It's a psychosocial rehab program. Touchstone is the name of the entity, but it's a Clubhouse model. But transitional employment is like temporary. It's to help them get back into the employment thing, and then they get something on their resume too, learn some skills, and then go get jobs. Like when those folks come to us, they can't stay indefinitely. They stay for a period of time, and then they go. Another person comes.
Okay.
So
one that I am aware with, Down Syndrome Awareness Month, and there's been some wonderful strides over the years with Down syndrome, so talk to me about that one.
Right, and Down syndrome is the most common chromosomal, that's always a hard word for me, I don't know why, condition that we see. But again, the Awareness Month allows us to talk about the opportunity it gives us the opportunity to talk about the strengths and the different things that people are able to do, the successes, and not focus on weaknesses and things like that. And also, sometimes people think, and Down syndrome is one of the few conditions where there are obvious physical characteristics.
Correct.
Where someone will go, I think they have Down syndrome. Okay, and if they have it, it doesn't mean that they're alike. Two people, because the range is it's so big, from mild cognitive impairment to severe.
Yeah.
Anywhere in between. And so anyways, I think that it's important that we again focus on people's strengths. There are people, I think I shared this, there's been a couple of cool different things. I just saw a thing too where a girl, it was on Facebook, but I think it was a real thing. It was a real high school where the girl, they crowned her like homecoming queen.
Oh, no, I saw that.
Yeah, and then
that was in the national news.
And then she needed didn't have a date.
Right.
I think the captain of the football team.
Right.
Said he'll take her, and he did like a little thing. It was really, It was so cool, and things like that just show that kids are they're a bit more educated, so they're not afraid of people with disabilities. They also understand everybody. We're all human beings. We all have feelings, all those kinds of things. And I think it's great when you see stuff like that happen, and kids are reaching out and they're being more inclusive, including them in activities and hanging out and being cheerleaders and basketball and football. And even if you don't get to play a lot, being a part of a team is a great thing for kids. I mean, some of us have kids that don't have any disabilities, and they didn't get to play much.
That's right.
So
then next month is one that, of course, affected you a couple of years ago, Breast Cancer Awareness Month.
Yes. So we know, and the numbers haven't changed. I guess it hasn't gotten worse, so maybe that's a good thing. But 1 in 8 women are going to get breast cancer at some point in their lives. 1 in 8. And I know so many, even in my friend group, that I think one time we had a get-together, and our numbers were more than 1 in 8. It was like 1 in 3 or 4.
Wow.
And so I've been almost 9 years cancer-free. So that is great. I still wear my cancer gear, though, this beautiful bracelet with the cancer sign and lanyard.
The lanyard with the beautiful.
Yep. Pink ring.
Oh, yeah, you got it all.
Got it all. But breast cancer, it's a scary thing. It's a journey. The biggest, most important thing is that women have got to get regular mammograms. You got to you do your self-checks. You're concerned about anything, you've got to talk to your doctor, because we know that early detection saves lives. It saved mine, because I had a really aggressive form of cancer too. And I said, "How long do you think I had that?" Because it was kind of big.
Right.
But I had my mammogram the year before, and
everything was fine.
Everything was fine. So you need to make sure that you're aware of what's going on with your body, and if you notice anything different, you've got to go to the doctors.
And when you catch it early, like you did, life goes on.
Yeah.
And you were slowed down, but you never stopped.
No, I was slowed down. We talked about that not that long ago, because I said I am not a person that can take daytime naps. But when I was undergoing chemotherapy treatments and radiation, I was able to take naps. In fact, I had to take them. It was a journey. And another thing I like to mention about it is I was overwhelmed with the amount of support from my colleagues, from the community, family, friends, everybody. And I say that if I got diagnosed with schizophrenia, would I have gotten that level of support?
No.
I don't think so.
No.
But you should. You should get the same amount, because that's a devastating diagnosis too, just like breast cancer. You can't control it, and people need to learn about it. They need to understand how to support a person. So just like people learned how to support me with my breast cancer, support people who have mental health issues, and even if it's substance use, all those things, any of those things. So I just think that's a good thing because, we talk about integrated healthcare, and that's what none of the things are things that we make happen to ourselves.
No. You brought along a flyer, and I'll hold it up for the camera here. Talk to me about this. This is something that's happening statewide, and you wanted to bring it to our attention, and I think it's important that people do understand what this is. Michigan Public Mental Health System is at risk. What's that all about?
Right, because the Michigan Department of Health and Human Services has decided that they should issue a competitive request for proposals to find new managers for the public behavioral health system in Michigan. Currently, there are 10 regions in the state of Michigan. There are 10 managers, but they are all public managers of the public mental health system. So in St. Clair County, you might have heard about Region 10. Region 10, it's called a Prepaid Inpatient Health Plan, or PIHP, or now they're calling them regional entities, the regional entity. So, but that St. Clair County CMH, Sanilac County CMH, Lapeer, and Genesee, we formed Region 10. We're not a part of it directly, but we formed it, and it was endorsed by all the county commissions, and so we still there's local control, even though. So what happens now? The Medicaid funding comes to that regional entity, and then they contract with the CMHs. So we currently get over $100 million in Medicaid funds from the regional entity.
For all that area?
For all of St. Clair County.
Okay.
St. Clair County has about a $120 million budget now.
Wow.
I know it's grown a lot.
Yeah.
So anyways, the state of Michigan's allocation for behavioral health services is about $4 billion annually, $4 billion. So the private sector, like Blue Cross, Humana, all those private healthcare, they are called private nonprofits. I don't understand the nonprofit part of it.
Right.
Because they make a lot of money.
Right.
The CEOs make anywhere from $5 million a year to Blue Cross is the highest paid at the Michigan Blue Cross. Last year, I think $13.5 million with salary, bonuses, and other compensation. That's wild to me. So anyways, but we know, they didn't really manage the benefit for the mild to moderate mental health issues. They ended up giving that to us, basically, or paying for it through us. So I'm not sure how they're going to manage the people that we provide the care for. I'm not sure that they even know who they are. I don't think the state understands who they are. We recently filed a lawsuit against MDHHS, and there was a court hearing last week. Unfortunately, what the judge said is, he said something like, it's not an exact quote, but something like, unfortunately, I can't rule on something and say it's a bad idea, you shouldn't do it, which to me implied he thought it was a very bad idea. But he said, I have to find a law that has been broken.
Yes.
So he found, he said that the state is allowed to issue the competitive RFP, but they have been sole sourcing, meaning they've been going straight to the counties and the public system for 60 years. For 60 years, they've had a waiver to do it the way we do it, and now they want to issue a thing and privatize. They're saying people want more choices, but they're saying of payers. I don't think people care who their payer is. They care who their providers are,
right.
And we give them a choice of providers. They're saying that they're going to reduce administrative burden. They're going to increase administrative burden. There's so many things. So we know that privatization in other states has led to service cuts, poor outcomes for the people, especially those with severe issues. Our Michigan has been nationally recognized on many occasions over the years, and I've been in the system a long time. This is the fourth iteration of trying to privatize since I've been involved. And we've been able to fight it off. I'm a little nervous this time. And it's really kind of wild, too, because, and I don't want to get all political, but typically, the other times, it was under a Republican administration in the state. Now we have a Democratic administration trying to privatize our system.
Okay.
It doesn't make any sense to me.
Right.
So anyways,
So it's the legislature that's making this decision?
No, a lot of the legislators are opposed to it.
Okay.
They're not pleased. We had a legislative briefing July 14th, and I had about 12 to 14 legislators and or their reps at our building. We went through the whole thing. Mark Hackle came from Macomb. He spoke at it. He's 100% opposed to it. Jay Du Boyers, Phil Kraft is one of his top guys. He's also the chair of the Macomb County CMH board. And so he knows it's a bad move. And so there's a lot of people that know that this would not be a good thing. Senator Lowers, I've talked with him about it. He's not in support. I don't know what they can do to stop it. So I hope something, because...
Is there a deadline? When is there...
Well, they issued, the request for proposal went out. The proposals were due Monday of this past week, so that would have been October 13th. And so the lawsuits are continuing. So I'm not sure. They tried to they filed for an injunction, our side, but they didn't do the injunction, which would have stopped it, for, at least for a bit until it was appealed. So what we've asked people to do is, if you look at our Facebook page, there's so many areas that will take you to an advocacy page on our website. There's letters that you could send. There's phone numbers that you can call people, including Gretchen Whitmer, Elizabeth Hertel, she's the head of the Michigan Department of Health and Human Services. Or you can send, these are postcards that we made these. And if people want these postcards, we have them at our work, or at all of our locations actually. You can write whatever you want. We'll even give you stamps if you want. So that this is just another way to try to get the message out there. We've also posted a lot of, they're called action alerts, and it will say, action alert, we'd like you to take action, and you click into it, and then it would be a letter going to a legislator about, or the governor, or whoever. So those are the things that are happening, and I don't know if people realize, but the Michigan public mental health system serves about 300,000 people.
Wow.
So, and some of these people have severe mental health issues.
Yeah.
And I just don't know how that's going to go. And
the people that are served are not complaining.
No.
They're not saying, hold it, let's change the system.
No, and that's what's kind of frustrating too. The Michigan Department of Health and Human Services said that they issued a survey to Medicaid beneficiaries, but also to providers, to family members, to a lot of people. Like I responded to the survey because I'm not only the mental health director, I'm also a parent of somebody who has been in the system a lot.
Right.
So I know it from both sides. So it asked questions, and they tried to say that the survey results indicated that the people want to change, they need more choice, they need this. And then our state association asked to see all the results. They FOIA'd all the data. The state couldn't find it.
Ah.
But then, so that was one of the things we told at the legislative hearing or briefing that we had. And I think it was Representative Jamie Green, who is on the oversight committee, which Jay Du Boyers is on too. And she said, no, they have to respond to a FOIA request.
Right.
And later that afternoon, our state association had all the data. So they compiled it. Less than 1% of the people said that they needed a change.
Amazing, amazing.
So it's because, I don't know, well, and one of the things we say is that you know those health plans, they have a ton of money. They have been lobbying hard and heavy for years look how much money Blue Cross funded Whitmer's campaign.
Yeah.
I mean, that's all public information. Those entities have funded millions of dollars. We have funded $75,000 a year, $50,000 maybe, not, and I don't mean St. Clair County, I mean our state association as a whole. That's all we have. We don't have money to do that.
Right.
So we really try to get our point across by grassroots advocacy and people writing letters, people making calls.
Well, maybe we can make a couple more people aware.
Maybe. And just go to our Facebook, and there's a lot of great impact videos too.
Okay.
That people can watch.
Before we leave, I want to throw that number up again, the 810 number. This is the new phone number for St. Clair County Community Mental Health, 810-488-88888.
I like 488-8888.
All right.
Isn't that
all
easier
right.
to say it
There
that
you
way?
go.
I know I was doing it the way you were doing it, and I was like, did I say enough 8 chat? So 810-488-8888. But please, if you're in crisis, don't hesitate. Or if you're not even sure if you're in crisis, call the crisis line, 810-966-2575.
Deb, always a pleasure.
Always a pleasure to see you.
And that's about it for this edition of the Focus program. Thanks very much for tuning in. Till next time, I'm Paul Dingeman. See you soon.
Thanks for watching Focus with Paul Dingeman. Focus is produced at the CTV Community Television Studios in St. Clair. For over 20 years, CTV has captured the moments that matter to our community.